Good morning. My name is Roberto Ramirez. I'm one of the nurse practitioners here in the inpatient psychiatric unit.
Hello,
Okay, so
I'm Lynn.
what's your name, ma'am?
I'm Lynn.
You're Lynn?
Lynn.
How would you prefer me to call you?
Lynn.
Lynn? Okay. So what brings you into the facility?
I have no motivation. I've just been feeling like just hopeless.
I'm sorry, man. When did you feel this way? When did your symptoms start?
Like ever since I moved here from my hometown, like about 7-8 months ago.
7 months ago. Okay. Are there any triggers to your symptoms of depression?
When I guess the weekends when I'm just alone and I don't have anyone to really talk to.
Okay. Do you have any history of trauma?
No.
No. Or any stressors? Any
No.
life events that contributed to these symptoms that you're feeling right now?
Yeah, I just moved about 6 months, 7 months ago. And I don't have friends here or my family is like back at home. Just feeling lonely.
I'm sorry to hear that, man. Have you been hospitalized before, inpatient or receiving outpatient services?
Just hospitalized when I was 17.
When you were 17?
Mm-hmm.
Were you started in any psychiatric medication?
When I was 18.
When you were 18? Okay. Were you started in any mental health medication?
Oh, I think they put me on hydroxyzine.
Hydroxyzine?
Yeah, I think that one.
Okay. So hydroxyzine, it works to manage your symptoms of anxiety. So it tends to decrease those symptoms. How often were you taking it?
I don't remember, like 3 times a day.
3 times a day? What were the dosages?
Like 25.
25? Okay. How often are you sleeping?
Like 12 hours, sometimes 10.
Okay. Have you followed up with your mental health treatment?
No.
No. So you're not taking any medication at the moment?
No.
Have you tried any therapy?
I think I did psychotherapy, but I just went to 2 sessions.
And how have you been feeling recently?
Just sad. I don't want to go to work. I just want to stay in bed.
How's your appetite been?
Like, I ate a banana and toast for breakfast, and I just won't eat because I'm not hungry. And I'll have like pasta or mac and cheese at night. Not good.
Not good? I'm sorry. Any thoughts of hurting yourself, hurting others?
No.
No. Okay. Are you hearing voices
No.
inside your head telling you to do stuff? No.
No.
Are you seeing things, seeing shadows, floating objects? No? Okay. Any thoughts of hurting anyone else?
No.
Okay. Have you had any anxiety? No anxiety?
No.
Okay. Any episodes where you feel like you're being followed or the TV's talking to you? No.
No.
Do you feel sometimes that you're feeling with superpowers, that you're more than anybody else? No? Okay. And you said you were hospitalized when you were 17, right?
18.
18? Okay. And you just, in the hydroxyzine, were you taking it daily? Do you feel like it helped?
I don't know. Yeah, I think so actually.
Okay, you haven't received any outpatient services, correct?
What is that?
Like when you're not hospitalized, you're going to a clinic to.
Oh, no.
No? Okay. Any medical history, surgical history?
When I was 10, I broke my ankle playing with my brother, but no, just that.
I'm sorry to hear that, man. You weren't hospitalized for your medical, for your broken ankle, right? Or for any medical diagnoses?
No, I wasn't hospitalized, but I do suffer from seizures.
I'm sorry to hear that, ma'am. Are you taking anything for that?
Yeah, like Divaporic,
Depakote?
sodium,
The
500 milligrams, like at twice a day.
Twice a day? Are you still taking that medication?
Yes.
Okay, so you're currently active with that medication. When was your last seizure?
I've been getting them more since I've moved here. I think just the stress from not being, from just being alone.
I'm sorry to hear that.
Like
ma'am.
2
Here's
weeks
some
ago.
Kleenex.
Thank
If you don't feel like you want to answer the questions, feel free to don't answer. And if you want to stop the session at any moment, feel free, okay?
Thank you.
Do you need some water?
No.
Okay. And you're taking the Depakote. Has it been helping?
Yeah.
Yes. When was your last seizure?
2 weeks ago.
2 weeks ago. Do they happen at night or during the day?
Any day. Anytime.
Anytime? Okay.
Because usually they just happen when I'm more stressed.
So they're stress-induced seizures?
Yeah.
Okay. Do you have any history of violent behavior? Do you tend to get violent or snap at people? No? Okay. Have you received psychotherapy?
Yeah, I did twice, 2 sessions.
You did twice? Okay. Was it helpful?
Yeah.
Are you still continuing?
No.
No. Okay. Any illicit drug use?
I don't do nothing like that.
You don't? That's good, man. Any alcohol use? No alcohol use? Okay, that's good. Any history of rehab? No? Okay. Do you have a history of family mental health disorders in your family?
Yeah, my mom had major depressive disorder, and I think she had anxiety, and my dad had I think bipolar 1, but they're both really loving parents, and that's why I miss them, because I just feel alone here, and I just miss them.
I'm sorry, ma'am. It must be difficulty living away from home. How are you feeling at the moment?
Just sad, tired, just don't want to do anything.
I'm sorry to hear that, ma'am. Okay. Any history of family substance abuse?
No.
No? Okay. Any history of suicide in your family?
No.
No?
I don't think so.
No? Okay. Where were you born?
Washington.
Okay.
I miss it so much.
I understand that. Or do you have history of being pregnant? Yes. When were you pregnant?
When I was 25.
25 years old. Was it a normal pregnancy?
Oh, I just had a miscarriage. I had a miscarriage when I was 25.
I'm sorry to hear that, man. But did your mom have a normal pregnancy? And how was your birth? Was it a cesarean or
It was a C-section.
C-section? Okay.
She had, I think, high blood pressure when she was pregnant with me.
High blood pressure. Okay. How would you describe your childhood?
Good.
Do you describe it as good?
Yeah, I have loving parents.
That's good. Any history of abuse in your childhood?
Oh, just
Sexual, emotional?
No, my dad would sometimes leave for days. Think he had, I don't know, like episodes, but other than that, it's fine. Nothing, no abuse.
No abuse?
Mm-mm.
Okay. Who were you raised by?
My parents.
Are your parents single or married?
Married.
Married. Both are living?
Yeah, and I miss them so much.
I'm sorry, man. It must be difficult living away from them and starting a new job, a new employment, the environment.
Yeah.
Okay. Um, where are you working at the moment?
Corporate computers.
Corporate computers? Okay. What's your position?
I'm a computer engineer.
Oh, that's nice. That sounds like an interesting
Computer
job.
science engineering. It's okay.
That's good. That sounds like an interesting job. Have you had any problems with your job at the moment?
I just don't want to go to work. I just want to be in bed all day.
You just want to be in bed all day? Okay. I'm sorry to hear that. Were you in the military in the past?
No.
No? Do you suffer from any disability?
No.
No? Okay. Do you have any legal problems in the past, such as arrest?
No, not at all.
No? Okay, that's good. What are your religious views?
I don't believe in anything at all.
Is there a reason why?
No, I just don't.
You don't? So you don't believe in higher power?
No.
Okay. Are you sexually active at the moment?
No.
No? Have you had any previous relationships?
Yeah, but we broke up because I was gonna move here.
I'm sorry, man.
It's okay.
And you said you had a miscarriage, correct?
Yes.
Yes, okay. Did you have any problems with your sexual history? No?
Just had a miscarriage and that's it. That's it.
When was your last menstrual period?
2 weeks ago.
2 weeks ago? Okay. Any significant medical illnesses at the moment?
Just the seizures.
Just seizures? Okay. And have you been hospitalized for your seizures before?
No.
No? Okay. Any past surgeries? No. So you confirm history of seizures. Any head injuries in the past with the loss of consciousness?
No.
No? Okay. How would you say you're feeling at the moment?
Just sad, I guess.
You're feeling sad. Sorry to hear that, man. Okay, man. So I'm gonna say 3 words and you're gonna repeat them after I let you know when to repeat them, okay? Okay, ballpark red.
Ballpark red.
Okay. So I'm gonna give you this paper, ma'am, and I want you to fold it in half and leave it on the floor. Okay, thank you. I want you to draw in this object that's here on the paper and draw it as similar as possible.
I used to be a painter. Those were my interests. I don't paint anymore.
Okay.
I find no pleasure in it.
That's a nice hobby.
There you go.
Thank you, ma'am. Okay, what were the 3 words I told you?
Red ball. Hair.
Okay. So they were ballpark red. Okay. But you do seem like you're a little bit sad at the moment, obviously. How would you say your concentration is?
It's not there. I have trouble at work. And sometimes I take forever or longer than I should to like finish my tasks.
To finish your task? Like, how would you say it? How would you describe like not finishing your task?
Just like I just can't concentrate because I don't know, I just don't feel like being there.
You don't feel like being there?
Oh, I just feel guilty that I'm there, and I'm not with my parents, and they're getting older, and I'm just not watching them. I'm just not being with them.
I'm sorry, man. How's your sleep?
Oh, I just work a lot. I sleep a lot.
You do?
Yeah.
Okay.
I just want to be in bed all day.
What are your hobbies?
I paint, and that's it. Read sometimes.
Okay. Has your activity increased or decreased in the current?
Decreased. I used to take walks, and I just don't. And then now that with the fall seasons here, the sun goes down way faster and earlier, and I just don't feel like being outside. It's cold. I just don't.
Right. No, it must be very difficult to control the emotions during a time change because our body is used to a rhythm, and we usually tend to sleep. We need to sleep 8 hours a day. You're obviously been sleeping a lot, right? You've been sleeping, you said about 10 hours, correct?
Yeah, more or less.
Okay. I'm sorry to hear that, man. And you haven't seen your brother?
Oh, I miss him too, because he lives so far away from me. He lives in Las Vegas, Nevada. And I live in Virginia. It's so far.
Right.
And our time schedules, and we just can't talk to each other a lot.
Right. I'm sorry to hear that, ma'am. Okay, ma'am. So, upon the data I obtained here during the assessment, I do believe that you have major depressive disorder, which is also called MDD.
I understand.
Due to the symptoms that you're exhibiting at the moment, such as oversleeping, and your appetite has been poor, you're not meeting your nutritional needs. I do believe that you meet criteria for major depressive disorder, but I would further investigate more on how therapy is gonna work for you. You're gonna receive outpatient services. I'll have the caseworkers work with you with your next appointment, with therapy services, outpatient services. Okay?
Thank you.
Is that okay, friend?
Yes.
Yeah. Are you willing to follow up with the treatment team? Okay, ma'am.
Yeah, I just want to feel better.
Right, and that's what our goal is here. We're making sure that your symptoms are getting resolved. I'm going to go ahead and start you on Zertrolin, 50 milligrams, and you're gonna take it in the morning, after you consume your breakfast meal. Okay?
Okay.
And the instructions will be on your medication prescription. Okay, so make sure you take it. If you have any side effects, you might feel a little bit drowsy, or any unstable changes or patterns in your sleep or mood. Please let me know, or let one of the members of the treatment team know, so it can be addressed. Okay, I'm gonna start you on 14 days, and then the caseworker will follow up with your next appointment date. Okay, is that
Thank
okay?
you. Yes, thank you.
Okay, so this is an antidepressant.
Okay.
It's gonna increase your serotonin levels, and it's gonna make you feel less depression. It takes about 4 to 6 weeks to take effect, so you might not be seeing changes, um, like from night to day. Okay.
Okay.
Um, can I please have consent, ma'am? I just need you to sign here. It's just saying that you're going to start with treatment and you're willing to consent for the medication. Do you have any questions, ma'am? No? Okay, ma'am. So yeah, the caseworker will go ahead and follow up with you. Okay, ma'am? Thank you so much for your time, ma'am.
Thank you.
Thank you.